I am Michael Keller. I am a pulmonologist with Suburban Lung Associates with AMITA Health in the northwest suburbs of Chicago. And today I'd like to spend some time talking about the role of exercise in pulmonary hypertension. So we know the benefits of regular physical activity are tremendous for all people. It's well recognized that there's a significant cardiovascular benefit. Regular exercise can reduce the risk of stroke, of developing diabetes, of developing high blood pressure. There's also significant benefit in reducing the risk of certain cancers like colon cancer. And we know regular exercise can help improve people's mood and reduce feelings of depression and anxiety. So there's many benefits for healthy patients and patients with different cardiovascular diseases. When we look at body's response to exercise in the setting of a normal heart, we see that heart squeezes out up to 4 to 5 times as much blood during a state of exercise compared to when it's at rest. And the reason it needs to do that is to deliver extra oxygen to the exercising skeletal muscles. We know that the blood pressure increases to help facilitate this as well. When you look at the blood flow through the pulmonary arteries in the lungs, when the heart is pushing out more blood to accommodate the exercising muscles, the resistance to blood flow in those arteries in the lungs actually decreases to help facilitate that, and it leads to only a mild increase in blood pressure in the lungs during exercise. When you look at a patient with pulmonary arterial hypertension, the underlying problem is an increased resistance to blood flow in the arteries in the lungs. And so when you begin to exercise and your muscles demand more oxygen and your heart wants to pump out more blood, you become limited by that increased resistance to blood flow through the lungs. The right side of the heart is not able to get as much blood through the lungs to the left side of the heart and to allow the left side of the heart to then pump that blood out to your muscles, which leads to the symptoms of shortness of breath with activity or with exercise. And at a more advanced state can even lead to symptoms of lightheadedness with exercise or chest pain. So there is another limitation in patients with pulmonary arterial hypertension, in that we know their muscles, their skeletal muscles, the big muscles in their legs and their arms, do not function as well as somebody without pulmonary arterial hypertension. And this has been looked at by taking small biopsies of those muscles. When you compare them, the muscles in a patient with pulmonary arterial hypertension are generally more atrophied and smaller. Their contractile strength is not as strong, and there's a lower number of the muscle fibers that we use for endurance activities. We also know that these muscles tend to change the way they process energy, and they start making acid that builds up in your blood sooner than a patient without pulmonary arterial hypertension. So if we look at our current recommended treatment algorithm for patients with pulmonary arterial hypertension, supervised exercise training is a recommendation for all patients. And there used to be concern years ago that exercise for patients with pulmonary arterial hypertension could potentially be dangerous. And it's really been over the recent years that we've recognized it's not only safe, but has significant clinical benefit as well. There have been a number of small studies, usually only 20 to 30 patients, looking at the role of exercise in pulmonary arterial hypertension or in patients with CTEPH. And there was a group that took all of these small studies and put them together in a systematic review and came to the conclusion that in patients who are stable on their current medications, a supervised exercise training protocol leads to significant improvement in their 6-minute walk distance. And the amount that walk distance improved is actually greater than nearly every single trial of a drug that led to an approved new therapy. They showed that muscles were able to uptake more oxygen after an exercise training program. What patients care about most is that it led to an improved quality of life. And importantly, there were no major adverse events. And in a stable patient undergoing a supervised program, we've learned that it's safe, that exercise is not dangerous. There was also another study done in which they actually measured the function of the heart and the resistance to blood flow through the lungs before exercise and after a supervised exercise program. This protocol was fairly intense in that the patients were in the hospital for the first 3 weeks and then followed at home with a continued exercise program for another 12 weeks. Again, all these patients were stable on their therapies between 1 to 3 different drugs. And what they showed was that at the end of that exercise training program, that the heart was able to pump out a significant more amount of blood. The resistance to blood flow through the arteries in the lungs had reduced. and this has led to a reduction in the mean pulmonary artery pressure in the lungs as well. So additional evidence of the significant benefits of exercising and improving the condition of the skeletal muscles, not only on how patients feel and their quality of life, but actually on how the heart and lung function. And although we've shown over recent years that exercise can be safe and is an effective adjunctive therapy in pulmonary arterial hypertension, we do still approach each patient individually and with caution. Again, before anyone begins any type of exercise routine, they really need to talk with their PH care team to understand what is safe for them and what sort of limitations they should have in place. Some general limitations that we talk about are not overexerting yourself. I often tell my patients to listen to their bodies, and we recommend sort of a symptom-limited exercise program. And that if any of these concerning symptoms such as lightheadedness, chest pain, racing heart, or excessive shortness of breath develop, that's a little too intense of a regimen. They need to take a break and slow it down. We generally recommend avoiding very strenuous exercise such as heavy lifting that requires you to really bear down, or again, anything that involves a very intense aerobic exercise routine. One other caution that we often bring up is to avoid exercises that involve significant movement of both your arms and your legs at the same time, because the amount of extra demand on the heart that will create. I generally recommend an aerobic exercise training program that can involve simple walking, working on a treadmill, exercise bike, an elliptical. Other forms of exercise such as yoga, Pilates, swimming can be safe and effective as well as light resistance training. Again, we recommend avoiding heavy lifting that results in you really holding your breath and bearing down, but light resistance training can help improve your muscle strength and endurance as well. How this can be accomplished is coming up with a program that you can do on your own, or if you have access to a fitness center or a gym where you can exercise. There are some formal exercise programs as well that can be offered through a hospital setting, which is a pulmonary rehab or a cardiac rehab program. The limitation for pulmonary hypertension patients is that pulmonary hypertension is currently not a diagnosis that is covered by Medicare and many private insurances for completing a pulmonary rehabilitation program. Some of our patients who have comorbid or other lung diseases such as COPD, we may be able to qualify. And some of our patients have abnormalities on their pulmonary function test that will allow them to qualify under their Medicare guidelines, although they don't have a diagnosis of COPD or another lung disease. And these formal pulmonary rehabilitation programs are nice because they are supervised by trained nurses and therapists. In addition to the exercise routine, they generally include some group education as well, which focuses on nutrition, oxygen therapy, and you're meeting other patients with pulmonary hypertension and other lung diseases, and it ends up being a good support group as well. So in summary, we know now that exercise is safe for pulmonary arterial hypertension patients when done with certain limitations in place, and then it can lead to significant benefits in how patients feel, even in improvements in the function of their heart. And again, I'll stress the importance of being sure that everyone talk with their treating care team before beginning an exercise routine so they do know what is safe for them and what sort of limitations they should include in their exercise program. My name is Dr. Michael Keller, and I'm aware that I'm rare.